18th year, 19th year, they are at least equal to a lot of Krok tests repeated. Yes, you told me that you haven't 19th year and 20th year. Yes, and now we'll begin from 18th year and examples of examples of this test, guys. And first question, let's begin from Tchunya present. Please read the test number 1.
A 10-year-old girl exhibits high level of physical development. Her body length increased by 10 centimeters within a year. The number of permanent teeth corresponds to the age norm. Development of her secondary sex characteristics is 3 years ahead of her age. Development rate ahead of her biological age can occur due to endocrine disorders.
Endocrine disorders, why? Guys, you know this formula, yes? It is development of mammary gland present, yes? Growth of the hair of the os pubis and axillary area, and presence of the menarche. Who know what does it mean, menarche?
Part of menstruation.
Yes, you know, it's very good. Так, I want to see how many students. Kaushal came to us, yes? Now I pointed. Так, why it is endocrine disorders, guys? Why not it is, for example, acceleration?
Because there's no other organ changes.
No, acceleration also no changes, guys, but acceleration, it is only height of the person, yes? But there is no development of the sexual organs. Yes, there is no growth of the os pubis. Of course, it deals with the hormonal disorders. Diet cannot cause these disorders. Yes, hygienic education at all. Yes, and sports training also, she can become strong, or maybe the height increase, but there is no changes of sexual organs. Here we have, of course, endocrine disorders. It is methodic recommendations you see here, every option described. Why this answer, why not that answer? Yes, I prepare for the students. Maybe if you want, I can send you this Krok as you want. The next, please. This question I want to say, thank you. Repeated every year. And Navjot Singh, please read the test.
The pregnancy is full term. The body weight of parturient woman is 62. Fetus is in longitudinal line. The head is engaged to the pelvic inlet. Belly circumference is 100 centimeter and uterine fundus height is 35 centimeter. What body weight is the fetus can be expected? It's a 3.5 kilogram.
Why this 305 kilogram is right? How we estimate
calculate the belly circumference into uterine fundus height.
Yes, thank you. Yes, Tandinmeister formula we name this. Yes, and usually we plus minus 200 grams. Yes, and it is the expected weight of the feature. Yes. The next, number 3. Number 3, and Shania came to us. Read, please, the test.
A 22-year-old woman, Gravida Para, arrived with complaints of sharply painful contractions that occur every 4 to 5 minutes and lasts for 25-30 seconds. Amniotic fluid did not burst. The fetus is in transverse lie. Fetal heartbeats are not affected. Contraction ring is acutely painful, located obliquely at the umbilicus. What is the most likely diagnosis? Impending uterine rupture.
Do you remember somebody asked me about the impending uterine rupture, it means risk of the uterine rupture. Yes. What are the signs of this uterine rupture? Can you tell me in this test?
Teacher, like a uterine contraction. Ring is like
Yeah.
very painful during
No,
contraction.
it's not an evident sign. No, maybe pain, sharply painful contractions. But what, guys, you again, you don't pay attention to the keyword of this test, my dear, or you don't listen me attentively, or don't listen at all, my dear. Yes, yes, who answer me? It is contraction ring, oblique position, maybe transverse, but oblique very often, yes, and on the level of umbilicus. This is the main. In the no impending rupture, I never see this, but risk of the rupture maybe. Uterine rupture here, no, because we have fetal heart beating, you see here, yes, contractions of the uterus. But remember about this, usually they describe you contraction ring if they speak about the impending or risk of the rupture of the uterus. Please, Khan, read the test, the next, number 4.
A 16-year-old girl has primary amenorrhea, no pubic hair growth, normally developed mammary gland. Her genotype is 46XY, uterus and vagina absent. Testicular feminization.
No, not fertilization. Fertilization, it is a possibility for conception, to be pregnant, yes? Fertilization, feminization, testicular feminization syndrome, yes? Khan, why? What
Because
does
of
it
the
mean?
white,
Who knows, guys?
Teacher, it means that even when the androgen is released in the girl, it is not responding.
Again, Suresh, I don't exactly understand you. Can you repeat it, your opinion, please? Suresh.
Like even the girl, the androgen hormone is being released, but the body doesn't respond to that androgen. So there is no.
My dears, it's not at all we speak about the androgens release if it is is not response. Yes, you are quite right. Yes, because there is no alpha reductase. Yes, and it's not sensitive for androgen hormones. Yes, and usually it is. And what we at least have, we have how looks like this woman, guys. Testicular feminization syndrome, or it is what?
Pseudo hermaphrodite, teacher.
They looks like as woman, but with and internal genitals is the testis, is the male, because testosterone produced, there is no ferment alpha reductase which makes sensitivity of the organism to this testosterone, and that's why woman has female type, looks like a woman, but inside you see here what they have: no vagina, they have no uterus, yes, and usually they give you genotype 46 XY, yes, XY, we name this XY, yes, and it is syndrome of testicular feminization. We return to this topic when we have the disorders of the menstrual cycle, but usually we I forgot, because Nakali came to me. I forgot what I want to say, my dears. But keywords, guys, 46XY and absent of vagina and the uterus. Yes, it is testicular feminization syndrome. These testes can occur in the labia majora, may be present, and about the sex is very difficult to say if it is woman or man. Then next, please. Так, who was answer? Shanil, yeah. The next, please, Khan, read the number 5.
I just did, teacher, the previous question.
Number 5, 6. You have a question?
No, I already read the question, the previous one.
Khan, just Khan was, yes?
Yes.
Так, Mandip Singh.
6 hours ago, the water of a 30-year-old Gravida was para 0 burst. Her primary period was pathological and lasted for over 2 days. The term of pregnancy is 39 weeks. No labor activity is observed. Fetal head present above the pelvic inlet. Fetal heartbeat 142 per minute, clear and rhythmic. On vaginal examination, the uterine cervix is not dilated. What further tactics should doctor choose? Cesarean section.
Your argumentation, please. I wait.
There's
My dear,
no labor activity, but the fetal head present in the pelvic inlet.
No, first of all, what we have here? No, what do you remember? I told you they told about the pathological preliminary period, yes, and lasted for 2 days. Imagine, should be 4 hours, but lasted 2 days, yes. Mature pregnancy, there is no labor activity, yes, and it is the test when we speak about the pathological preliminary period, yes. There is no dilation of the cervix. No, what does it mean? It means that birth canal is not ready for labor. But woman for 2 days suffer from the pain, irregular pain, pathological preliminary period. That's why it is cesarean section. What is the keyword? Preliminary period, pathologic, 2 days, yes, it is cesarean, and uterus is not cervix is not dilated. The next, guys, number 6. Number 6 and Vilimba, please. Hinda, where is you? Milima. Where is Milima? No, disappear, guys. Так. Oh, there is no connection. Guys, are you hear me?
Yes,
Yes,
teacher.
but where is Milima?
We'll text him, teacher. Just a minute.
I wait. Vilima. Vilima absent, my dears. Excuse me. I asked her. Mahanti, please read the test. Yes, guys. Apgar score 9, it's good condition of the feature. Less than 7. Apgar score. It is signs of mild asphyxia, maybe, yes. And if it is 9, it is good condition, and we give breastfeeding just in the delivery room after labor. Yes. Number 8. Так, Mahanti, please read the test. Oh, excuse me, Natalia.
The gynecology unit
Received the patient with uterine bleeding that started 6 hours after induced abortion at the term of 11 to 12 weeks. Objectively, the skin is pale, pulse is 100 per minute, blood pressure is 170. On vaginal examination, the uterus is painless. Its enlargement corresponds to the 10th week of pregnancy. Uterine cervix is dilated enough to let in one finger. There are fragments of the fertilized ovum. What actions should be taken next? Agent repeated curettage of the uterine cavity.
Yes. No, what we have here? If we have the fragments of the fetus
The
ovum,
fetus.
we need to remove these fragments. Yes, with the help of repeated curettage. Sometimes it happened when because the curettage of the uterus doctors perform under according to sensitivity only, not visual examination with eyes, only to the sensitivity of its hands and curette. Yes. And that's why sometimes happens when the parts of the fetus or tissues of the chorion stay in the uterus. In this case, uterus cannot contract it, and we have bleeding, yes, after abortion. Of course, as soon as possible, we need to take again curette and need to perform curettage of the uterus. If we begin to do that, suggested as these options, we only lose the time. And we have the prolongation of this bleeding and aggravation of the condition of the patient. Thank you. Number 9, Nidhi, please.
A woman came to the general practitioner with complaints of fatigability, significant weight loss, weakness, and loss of appetite. She has been presenting with amenorrhea for the last 8 months. 1 year ago, she gave birth to live full-term child. Blood loss during delivery was 2 liters. The woman received blood transfusion and blood components. What is the most likely diagnosis? Sheehan syndrome because of the blood loss.
Yes, of course, blood loss, you're quite right. Sheehan syndrome, guys, it's my interpretation. Sometimes they can give you not Sheehan syndrome, but postpartum hypopituitarism. You need to remember, Sheehan gives us necrosis of the pituitary gland, and maybe in some Krok test, I meet this postpartum hypopituitarism. It's the same as Sheehan syndrome. Remember, please, about it. Number 10. Yamin, please read the test.
Yes. A 22-year-old woman complains of itching and profuse discharge from genital tracts. The condition developed 10 days after sexual contact. Bacterioscopy of a discharge sample detected trichomonas. What drug should be prescribed for this case? Metronidazole.
Metronidazole, trichomonada, metronidazole. Here I cannot explain you. You need to remember about it. Ampicillin usually it is antibiotics for syphilis, maybe for non-specific infection and erythromycin. Zovirax, it is valciclovir, it is viral infection, herpes.
Yeah.
Yes. Here metronidazole, you need to remember about it. Specific for Trichomonas vaginalis. Thank you. Number 11, Preeti, please.
A multigravida on 38th week of her pregnancy complains of increased BP up to 140/90, edemata of the shin for 2 weeks. In the last month she gained 3.5 kg of weight. Urine analysis, protein is 0.033 gram per liter. Make the diagnosis. It is mild preeclampsia.
More yes. If we speak, if we see about the, if we see on the level of protein, zero mild preeclampsia, it is 0.3, not more than 0.3. Here level you see, yes. Then diastolic pressure 90, of course, mild preeclampsia. Again, this test, again, guys, I am face classification. Here you see all kinds of preeclampsia, monosymptom hypertension, yes, and preeclampsia, mild, moderate, severe, and even pregnancy edema. Monosymptom dystosis and preeclampsia. Preeclampsia usually 3 symptoms, yes, BP, protein, and presence of edema. Here she gained 3.5 kilogram on a weight. Of course, it is mild according to the level of protein and level of BP. And if you know this classification, it's very easy to answer on this question, guys. And the last one for today, number 12, and for Suresh, please read the text.
A 15-year-old adolescent girl came to the gynecologist with the complaints of painful menstruation that are accompanied by nausea, vomiting, and dizziness. Her menarche was 12. Was at 12. Menstruation became painful since she was 14. Remain regular. What treatment should be prescribed in this case? It's analgesics, antispasmodic, and antiprostaglandin
therapy. Yes, the longest sentence is the key for the answer. Yes, for this question, guys. No, she has painful menstruation. Analgesics to decrease the pain, antispasmodics decrease these contractions of the uterus, and antiprostaglandin therapy. Usually it is, you know what drugs, it is ketanol, it is ibuprofen, it's maybe Nemesil, which promote decrease of the production of prostaglandins. Usually, if we have prostaglandins, increase of this prostaglandins production, we have increase of the pain, yes? And all this, of course, possible and useful if we speak about the painful menstruation. It is not really pathology. That's why anti-hemorrhagic, we have no anemia. Then anti-androgen therapy, no signs of androgen transformation. Vitamins gives us at all another symptoms. There is no signs of inflammation. That's why, of course, you choose this longest sentence. Yes, it is symptomatic therapy, which we use usually in order to decrease the pain during menstruation, if it is present. Maybe when he become elder, these symptoms disappear due to the increase of the production of the hormones. Yes, especially after labor, after first labor, disappear in most of cases, these symptoms, guys. Now, guys, about Monday. I don't know exactly. Maybe I sent information to your monitor. I told you that it's maybe a methodic meeting when in this case we need to begin our classes some later. I don't know exactly, but maybe at 10 o'clock. At 10. Remember, you hear me, guys? Yes?
Yes, teacher. Yes.
Maybe such situation, but I sent the information to your monitor. The topic of our classes, methods of investigation of the fetal conditions. What includes this topic? First of all, it is cardiotocography, biophysical profile, which is useful for you on Krok test and on exams. Biophysical profile, then Apgar score, then the simplest method of auscultation of the uterus, what we revealed during cardiotocography. You need to understand this. Yes, then biophysical profile we use all over the world for estimation of the condition of the fetus. That's why look through what does it mean in tests present biophysical profile. Then what else? Such conditions of the fetus as retardation, condition of the fetus, fetal distress, and the topic Placental insufficiency. Definition, what does it mean? What complex